now let's get into Medicare Part A. Um, let's see. I actually have some information on Medicare Part A. I'm gonna pull this up, William.
Okay, go right ahead.
So here we go, y'all. So I talked about we were talking about Medicare Part A, which is hospitalization. And a lot of people, William, mix Medicare Part A and B up. But can you explain what the hospital is when it comes to Medicare Part A? I guess it covers your inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. So that's covered under Medicare Part A.
Yeah, so I always like to put it in, I guess, terms. Let's say your aunt. We always go with the aunt. Let's say your aunt Susie fell down and she gets rushed to the hospital, and they say, "Oh, she's bad. She's got to be put into a room." Okay, that's inpatient hospital stay. Let's just say that they work on her and maybe we required surgery, and then after surgery they say, "Okay, she doesn't need to stay in the main hospital, but she does need some, I don't know, rehab and therapy, skilled nursing." Right there.
Right. Yeah.
So, go ahead.
Oh, I'm sorry. And I also forgot to say Medicare, we may have skipped just a little basic piece, but Medicare usually starts at age 65 or when you've been disabled for 24 months. That usually kicks off your start to at least your Medicare Part A, because, when you turn 65, they just go ahead and usually send you out your red, white, and blue card with the Medicare Part A already active for the month of your birthday. Usually you get those cards 3 months before usually be
yes,
William?
3 months before.
Mm-hmm.
That's about right.
So we're looking at 3 months before, and then you usually get your Medicare Part A card or your red, white, and blue card, and usually it just has the Medicare Part A there. How do you pay for Medicare Part A though? Because I know, like Felicia, you have a daughter that just started working, and she's now paying taxes. What's her experience being looking at her taxes, paying for her Medicare at 17, 18 years old?
She wanted to know who FICA was and why were they taking taxes out of her check, taking money out of her check.
Look, not taxes. They just taking money out of her check.
They just taking money out of who is FICA. Okay.
Right. So the good thing about Medicare Part A is that it's usually no premium, right? So you usually get it once you turn 65 because you paid those Medicare taxes all of those years. So if you pay, what is it? How many quarters, William?
40.
So you work for 10 years because there's 4 quarters a year. Yeah. After you work for 10 years, that's going to get you your Medicare Part A premium free pretty much because you pay for it all those times. But then catching back up to what we was talking about earlier, William, it's going to cover your inpatient hospital, skilled nursing, hospice care, and then some home health care. And that some home health care is a huge misunderstanding to most people. Like I speak to so many people who think that home health care is one thing, and then you realize that it's something completely different once you need it. I know, William, you've had that experience.
Yeah, well, you talked about it a little bit, I think, before about people thinking it's long-term care or something like that, and that's not it.
Nope. And then, Felicia, I know I've talked to you and some of your family members about the same situation, like thinking that your Medicare is going to cover you to go to a nursing home or stay in a long-term care facility. So that's always something that we have to push when we talk about Medicare Part A.
Exactly.
So the cost of Medicare Part A, though, William, this is another kind of misunderstanding that once you have Medicare, you don't pay for nothing else when it comes to healthcare. Surprisingly, that's probably not the truth. Fee, what do you know about that?
When it comes to the deductibles, you still have to pay, the deductible, which on the screen it was $1,600 per benefit period. So
right around there, yeah.
And so it can add up pretty substantially, I guess, if you're going in and out of the hospital with those benefit periods.
Right.
And a benefit period, William, is 60 days on the benefit period.
Yeah. So that means after a couple months, if you were to go into the hospital again, that deductible could come right back up again, right around $1,600 that you have to pay first before Medicare pays.
Yeah, absolutely. And see, the thing that's so scary about Medicare Part A, just having regular Medicare Part A, is that there's no max out-of-pocket costs. Like when we think about Medicare Advantage plans, like Medicare Part C plans, they usually have a max out-of-pocket cost that once you pay out-of-pocket that amount for the year, then you don't have to pay anymore for that remainder of the year. But when it comes to original Medicare, it's no stop loss. It's just no max out-of-pocket, which can add up pretty quickly.